As we found out, that's a whole lot of people out there. News 5's Mike Brookbank spent today learning about the latest health care plan. And Mike, a lot of people are worried right here in Northeast Ohio tonight.
Yeah, Frank, and for good reason. More than 100,000 people in Cuyahoga County alone rely on Medicaid. That program, under the current proposal, would see $880 billion in cuts. Even with those private health insurance, now those people also at risk.
Right now, the hashtag I am a pre-existing condition is trending on Twitter.
I worry that, the decisions that are made as the bill goes through its process, that it won't really protect those of us that have a pre-existing condition.
Kate Lodge now losing sleep at night, thinking about her health and financial future.
In a country this wealthy, you would hope that we would take care of, we'd figure out how to take care of people in the healthcare arena.
Lodge is living with a potentially debilitating disease.
I have multiple sclerosis.
Monthly treatments, which cost $10,000, keep her MS in check. Her insurance picks up the tab. That could soon change under the House-approved Obamacare replacement bill.
It would allow insurance plans essentially to discriminate who they would or would not cover at certain price points.
The list of pre-existing conditions covers everything from anxiety and depression to C-sections and cancer.
This qualifies for a lot of people and essentially could limit their ability to access affordable health care through private insurance.
The bill, which was passed by the House, would significantly reduce the $56 million a month that our large medical employers receive.
If any of that money is diminished, there's an economic sort of multiplying factor that's associated with that. There's less money in the economy.
Lauren Anthus with the Center for Community Solutions tells me it would also cripple Ohio's ability to tackle opioid addiction and its high infant mortality rate.
And the main conduit through which we solve those issues and other public health issues like lead poisoning is often through the Medicaid program.
As for those living with pre-existing conditions like Kate Lodge, they're holding out hope the Senate will make changes to the bill.
It's a scary thing when you think of the progress that's made and your ability to be able to be functional is threatened by changes in the law.
Now, even though they might be able to hold those conditions against patients, Anthus tells me there's no guarantee every insurer will. We're, of course, keeping tabs on what's happening in Washington, and Senate leaders saying today that while they will review the House bill, they will also write their own version of a health care overhaul. Live in the newsroom tonight, Mike Brookbank, News 5.